Before you start using Juluca, read the Patient Information Leaflet from your pharmacist. Take this medication by mouth with a meal once daily, as directed by your doctor. The dosage may be based on other medications you are taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Certain medications that reduce or block stomach acid may reduce the absorption of Juluca, making it less effective. Do not take certain medications like proton pump inhibitors, PPIs, H2 blockers, and antacids while using Juluca. If you take antacids, take them at least 6 hours before or 4 hours after Juluca. If you take H2 blockers, take them at least 12 hours before or 4 hours after Juluca. Products containing aluminum or magnesium, like antacids, laxatives, and buffered medications, may also reduce the absorption of Juluca. Take these products 6 hours before or 4 hours after Juluca. Calcium or iron supplements may reduce the absorption of Juluca, making it less effective. Take these products 6 hours before or 4 hours after Juluca. Or you can take this medication and the calcium or iron supplements together at the same time with a meal. It is important to keep taking Juluca exactly as prescribed by your doctor. For the best effect, take this medication at the same time every day. Do not take more or less of this drug than prescribed or stop taking it even for a short time unless directed to do so by your doctor. Doing so may cause the amount of virus to increase, make the infection more difficult to treat, or worsen side effects. If you experience a headache or diarrhea while taking Juluca, it's important to notify your doctor or pharmacist. Juluca has been prescribed to you because the benefit of taking it outweighs the risk of potential side effects. While many people do not experience serious side effects, it's important to be aware of the possibility of your immune system becoming stronger and potentially fighting off infections you already had. This could cause disease symptoms to return, or your immune system to become overactive. It's crucial to seek medical help if you experience symptoms such as unexplained weight loss, severe tiredness, muscle aches or weakness, severe or persistent headaches, joint pain, numbness or tingling, vision changes, signs of infection, signs of an overactive thyroid, signs of Guillain-Barré syndrome, signs of liver disease, or mental/mood changes. Additionally, changes in body fat may occur, and it's important to discuss the risks and benefits of treatment with your doctor. Lastly, Juluca may cause a rash, and it's important to seek medical attention if you develop any rash. If you experience any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. If you notice any other effects not listed here, contact your doctor or pharmacist. Before taking Juluca, it's important to talk to your doctor or pharmacist if you have any allergies to dolutegravir or rilpivirine, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so make sure to discuss this with your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, such as hepatitis B, hepatitis C, or any mental/mood disorders, such as depression. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. For women of childbearing age, it's crucial to discuss the risks and benefits with your doctor before using this medication. Let your doctor know if you are pregnant or planning to become pregnant, as they may direct you to get a pregnancy test before starting this medication. It's important to use reliable forms of birth control while using this medication, and it's not recommended for use during the first trimester of pregnancy due to possible harm to the unborn baby. If you are breastfeeding, it's important to consult your doctor before breastfeeding, as this medication can pass into breast milk, and because breast milk can transmit HIV. It's important to be aware of potential drug interactions when taking Juluca. This medication may interact with dofetilide, orlistat, and proton pump inhibitors, among other medications. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, do not take Juluca with other products that treat HIV infection or with other products that contain rilpivirine, unless directed by your doctor. Certain medications can affect the removal of rilpivirine from your body, which may impact how Juluca works. It's important to discuss any potential interactions with your healthcare provider before starting or changing the dosage of any medicines. If you suspect an overdose and the person has severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center. In the U.S., you can call 1-800-222-1222 for your local poison control center. Canadian residents can call a provincial poison control center. Symptoms of overdose may include fast or irregular heartbeat, severe dizziness, and fainting. It's important not to share Juluca with others. While taking this medication, you may need to undergo lab and medical tests to monitor your viral load, T-cell counts, and liver function. Make sure to attend all your medical and lab appointments and consult your doctor for more information. If you happen to miss a dose of Juluca, you can take it with a meal as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Remember not to take a double dose to make up for the missed one. When it comes to storing Juluca, it's important to keep it at room temperature away from light and moisture. Make sure to store it in its original bottle with the desiccant inside, and avoid keeping it in the bathroom. It's crucial to keep all medications out of reach of children and pets. When it comes to disposing of Juluca, never flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.